we all have some different type of emotion in different time, and anxiety is one of them. And if you look at this, that sometime we may be fearful for some time, or we may be we angry, or we may be in a pessimistic mood. So these are all the variety of mood. And anxiety is a universal phenomena, and this is one of the type of our mood. uh, Anxiety is actually necessary component of self-preservation. uh, According to Freud, a normal anxiety is a concern about a known danger, while a pathological anxiety is concern about a danger yet to be discovered. So therefore, if there is some problem, or there is some huge problem, like for example, these days the COVID-19, so everybody is a little bit worried. So that worry is normal phenomena. So actually, anxiety is an exaggerated response of a body to a stimulus manifested in different clinical symptoms that can be in the form of feeling of apprehension, worry, uneasiness, dread, especially of the future. And there are certain physical symptoms we will discuss later on. So there are what could be the terminology for anxiety, stress, and tension. So anxiety can be the term for anxiety in Urdu can be घबराहट, बेचैनी, अंदेशे, परेशानी, उलझन, इस्तिराब, इख्तिलाज. So while stress is सख्ती या दबाव, so it is basically a physiological response to a physical or psychological threat. So that the stress, that is called the stressor, which can be in the form of physical stressor or psychological or social stressor. The tension, which can be called as tanav, is a mental or emotional or nervous strain, and that increased and unpleasant motor and psychological activity. So what makes anxiety pathological? Anxiety can be considered as a disorder when it is irrational, that is, when the perceived threat is out of proportion with the actual threat. It can be done like somebody, जैसे शेर पिंजरे में बंद है, इसके बावजूद अगर हम घबराए हुए हैं, तो that is irrational या गैर मंतकी किस्म की घबराहट है. And the second is when it is higher in intensity, excessive in intensity, and when it is out of control and longer in duration, that least at least for generalizing anxiety disorder, 4 weeks, and in some classifications 6 months are required to diagnose generalized anxiety disorders. The most important thing is basically when disturbed performance. So normal anxiety is basically the one which will improve your performance, while pathological anxiety will disturb your performance. ये ऐसी ही है कि आप इम्तिहान में ये तक भूल जाएं कि नाम क्या है और रोल नंबर क्या है. That is the poor performance. So general consideration for anxiety disorder often have an early onset between usually in teenage or early 20s. The ratio female is almost double suffer from anxiety disorder, especially the phobic anxiety, and having waxing and waning course over lifetime. And similar to major depression and chronic disease such as diabetes in functional impairment and decreased quality of life. So anxiety can also disturb the quality of life and impair the function. The prevalence of anxiety disorder in population is basically the most common is social anxiety disorder, which is around 13.3% in the population, general population, while post-traumatic stress disorder is the second common anxiety type, that is around 8% of the population is suffering. Then it is followed by generalized anxiety disorder, and 5% of the population suffer from this condition. And panic disorder is almost 3.5%, while obsessive compulsive disorder is also around 2.5%. in general population. And basically, sometime person can suffer from one more than one type of anxiety disorder. For example, he may have generalized anxiety disorder along with OCD and so on. The prevalence in Pakistan, generally in Pakistan, people are having the combined anxiety and depressive disorder. It is sometimes considered as the anxiety and depression are considered as two sides of a single coin. This is a wonderful study carried out by Elias Mirza and Rachel Jinkin, which say that around 34% of the Pakistani community population is having anxiety and depressive disorder mix. Here you can see that this I'm sharing with the permission of one of my patient. If you look at this slide, she has written that तबीयत में घबराहट है, which is anxiety. दिल एक सेकंड भी खुश नहीं रहता, which is depression. तबीयत गैर मुतमईन रहती है और तरह तरह की फिक्रें आती हैं, that is again anxiety. And then she says that मामूली बातों का भी बहुत टेंशन होता है, this is also anxiety. And हर वक्त दिल उदास, गमगीन और अफसुदा रहता है, that is depression. बहुत ही मामूली आवाज से आंख खुल जाती है, that is anxiety. And तबीयत में मायूसी है, उदासी है, रोना आता है, तबीयत गुमसुम है, this is again depression. And तबीयत किसी भी वक्त फ्रेश नहीं रहती, किसी बात पे मुस्कुराहट चेहरे पे नहीं आती, which is again depression. So here you can appreciate that the person is suffering from mixed type of anxiety. She also fulfilled the criteria of anxiety disorder along with depressive disorder. So how to identify anxiety? There are certain screening questions, especially for the generalized anxiety disorder, 7 scale. 2 of them are very common, and one should ask, every general practitioner must ask from his or her patient at least these 2 questions to screen anxiety disorder. Over the last 2 weeks, how often have you been bothered by the following problem? Number 1, feeling nervousness, anxious, or on the edge. Number 2, not being able to stop or control worrying. So if somebody is having these type of worry feeling and uncontrolling nervousness and tension or anxiety, then the person must be evaluated for anxiety disorder. Here you can see that the DSM-5 has given patient-rated level 1 cross-cutting measure for adults. You can see that the question number 3 and 3 is related to anxiety disorder, and 6 and 7 is related to घबराहट, परेशानी, फिक्र या अंदेशा, and number 7 दहशतज़दा होना, खौफज़दा होना. So these are the 2, especially the 6 and 7 questions are related to the anxiety disorder. Once the person is screened, then we can apply these all different type of diagnostic tools, which especially I would like to focus on the Beck anxiety inventory, Hamilton anxiety scale, and we can also use the DSM criteria or ICD-10, which is the International Classification of Disease, and DSM is a diagnostic and a statistical manual of the disease. So these are the end. 13 number is the GAD-7 is the instrument. This is a wonderful instrument, especially to measure the generalized anxiety disorder. The causes of anxiety can be genetic. Here one usually say that anxious mother lead to anxious kids. So brain chemistry, especially the serotonin, the GABA and norepinephrine are responsible for the anxiety disorder. And the various neuroanatomical component of brain, especially limbic system, amygdala and cingulate gyrus, and cerebral cortex and hypothalamic pituitary adrenal axis are these areas which are responsible for generating anxiety disorder. There are certain drugs, like in the form of amphetamine, quinolone, and cigarette, that can lead to anxiety. Although people use cigarettes smoking for relieving the anxiety, but actually, cigarette, coffee, and cola, all these lead to anxiety condition. There are medical causes which can mimic anxiety disorder, like, for example, anemia, mitral valve prolapse, or pheochromocytoma. These are the physical condition which can present like anxiety disorder. And one of the other condition is hyperthyroidism, can also present like anxiety disorder. So therefore, before labeling the person having functional or psychiatric disorder, one should rule out the physical causes. The physical reaction to anxiety can be in the form of auditory or visual stimuli, or olfactory and tactile stimuli like smell, touch, sensation, bypass the thalamus. So these are the various areas which are, especially the amygdala, locus coeruleus. These are the areas which, and the thalamus is also, and hippocampus. These all area are responsible for generating anxiety. The primary versus secondary anxiety can be, anxiety may be due to one of the primary anxiety disorder, or secondary due to substance use. That's, I already told you that if somebody using alcohol or other substance, he or she can experience anxiety, or certain medical condition can also result. And there are certain psychiatric condition, schizophrenia or any other personality disorder, then can present with anxiety disorder. And psychosocial stresses like adjustment disorder can present with anxiety disorder. The maintenance factors can be avoiding the phobic situation. Generally, we recommend that in order to overcome anxiety and phobias, one has to face. So therefore, exposure therapy is recommended for them. And anxious self-talk, mistaken belief, withheld feelings, and lack of assertiveness, and lack of self-nurturing skill, muscle tension, stimulants and other dietary factors, and high stress lifestyle, and lack of meaning or sense of purpose. So how anxiety is generated? When there is some stimuli, for example, if somebody tell you that मैं आपके बेटे को या आपके वालिद को नहीं छोड़ूंगा, so first of all you will hear that threat, and then the psychic symptom will start in the mind, which can be in the form of tension, irritability, disorganized thought, panic attacks, insomnia, impotence, apprehension, fatigue, lethargy, and difficulty in concentration. This difficulty of concentration, usually medical students come with this complaint. Actually, they are having either anxiety or depression due to lack of concentration. So therefore, they usually complain of memory. So if their concentration is improved, their memory will improve. Then once the psychic symptoms start, this will trigger the bodily symptom through the sympathetic overactivity. So sympathetic overactivity will eventually lead to sweating, pallor, difficulty in breathing, butterfly in the stomach, nausea, vomiting, urinary frequency, muscle tension, aches and pain. So these all, and tremors of the hand and headache, all these symptoms can be the physical manifestation of anxiety disorders. So how to differentiate various type of anxiety disorder? This is very important slide. The generalized anxiety disorder can be characterized by excessive and pointless worry about a whole range of domestic and personal issues. That the person will always be anxious कि खाना हमारे मेहमानों का पूरा पड़ेगा या नहीं, बिजली होगी नहीं होगी, इस्त्री कपड़े होंगे नहीं होंगे सही, और इसकी तरह से जो है खाना पूरा पड़ेगा या नहीं, और बच्चा गया स्कूल से खैर वापस आएगा या नहीं. इसी तरह से अगर स्टूडेंट है, वो बार बार ये जहन में होगा कि पता नहीं पेन ठीक रहेगा मेरा या पेन ठीक नहीं रहेगा, लिख सही पाऊंगी या नहीं पाऊंगी. So these pointless, the various domain and range of domestic and personal issues are basically the presentation. Everywhere the person will be worried about things. The social anxiety is characterized by fear of scrutiny and or criticism associated with symptoms such as blushing, speech block, or tremor. So you can see if somebody is anxious and having social anxiety, he or she will be face very difficulty while giving presentation. The panic disorder is another type of anxiety disorder which is characterized by recurrent intense panic attack and anxiety, which can be associated with agoraphobia, that is a fear of public place, especially where escape can be difficult. So the panic disorder usually lasts for half an hour, and the person will have then repeated either that I may have another attack. The obsessive compulsive disorder, which is nowadays has been classified in a different chapter than the anxiety disorder, but generally OCD, or obsessive compulsive disorder, is also having predominant anxiety. And here the person will have either repeated thoughts, and which the person will consider senseless. He tries to resist that, but he or she cannot get rid of that. Or he or she may have repeated acts in the form of checking or hand washing, and despite the fact that the person will say, consider that these are my senseless activity, I have already done this, checking logs and other things repeatedly, that will eventually disturb his or her performance, and the person will be uneasy, feeling uneasy, and consider them senseless. The post-traumatic stress disorder is a condition where there is catastrophic type of stress in the form of man-made disaster, or the man-made disaster, or the natural disaster in the form of earthquake or flood. So here the person will have hyperarousal and re-emerging symptom in the form of flashbacks. So therefore, then this occurs usually after 1 month of the severe stressful condition. The specific phobias are simple specific phobia, fear of a specific object such as dog, mice, and spider. This is very common among our female kids, and they may also have fear of heights, flying, elevators. So these are these related to specific object or situation. The specific phobia may be present like these very stiff, and usually our female kids are having a lot of fear from these situations, which generally disappear with age. Prescribed medication causing anxiety like symptom may be cardiovascular medication like antihypertensive, antiarrhythmic, respiratory like a bronchodilator, and neurological like anticholinergic, anticonvulsive, anti-Parkinsonism drug, psychotropic medication, sometimes antipsychotic, and antidepressant, although they are useful to relieve anxiety, may sometimes lead to anxiety, and withdrawal of benzodiazepine and other sedative will also lead to anxiety disorder. The miscellaneous medication may be in the form of thyroxine, non-steroid anti-inflammatory drugs, antibiotics, and chemotherapy. The social effect of anxiety can be in the form of depression or unable to convey the person that you are, and fear and avoidance of situation where the previous attack occurred. Now, how to prevent anxiety? The prevention can be in the form of, if we encourage our kids, usually हमारे मुल्क में ये होता है कि बच्चे को डांटा जाता है कि शर्म नहीं आती, बड़े के सामने बात कर रहा है. अगर बड़े के सामने बात नहीं करेगा तो सीखेगा कैसे? So therefore, their innocent type of question should be answered politely and with encouragement. And if we develop established positive routine, especially if we have very good genetic load, environmental and family environment, this will eventually lead to healthy and happy and optimistic child, which will be free of anxiety. Uh, if we have a good ratio between our sleep, between our work, exercise, and our play, so that will also have a good lifestyle, can lead to it can be a form of prevention for anxiety disorder and also other physical and psychiatric disorder. And the role of media nowadays, if you look at the COVID-19 situation, they usually uh, tell us about the death occur as a result of COVID, and they are less likely showing the person or the number of people who are recovered from that. So constant breaking news or and repeatedly they are trying to give you such an information, which I usually call it infobesity. So infobesity is basically if you are constantly giving information and which are loaded and the person has having a fully loaded type of information which he cannot digest or she cannot digest. The therapeutic management of anxiety is basically promoting healthy lifestyle, that is decrease stimulant, substance and addictive behavior, increase physical activity in the form of exercise, especially sports, restoring biological and social rhythm with the help of a good routine in the form of proper sleep. Information about stress and coping skill, and then psychotherapeutic intervention can be in the form of non-pharmacological interventions such as cognitive behavior therapy, where we improve the understanding and cognition of the person, that will eventually lead to good behavior. Then relaxation techniques like deep breathing exercises or brief psychodynamic psychotherapy, these all can lead to reduction in the anxiety. And promoting social interaction and professional activity, especially if we are control or bullying and other stalking, and promotes good social interaction, facilitating each other and also nurturing relationship, this will eventually lead to reduction of anxiety. There are certain non-pharmacological options for anxiety management that can be in the form of communicating skills like doctor-patient relationship, then listening and understanding of the patient, reassurance and counseling, and then sharing problem. And the advice can be on the lifestyle in the form of balanced diet, especially avoiding coffee, tea, cola, chocolates. Instead, we should encourage yogurt and milk, and exercise when it is, if it is not contraindicated, especially sports can lead to reduction in anxiety and having good effect on the mind. Smoking should be totally stopped or at least reduced, because it has not only physical hazards but also psychological hazard in the form of producing anxiety. Sleep hygiene is a wonderful interaction, and this is the one of the Allah Ta'ala की बेहतरीन नेमत है. We have to utilize it. जल्दी सोना जल्दी उठना जो है अच्छी दिमाग के लिए ज़रूरी है. The relaxation technique, as I already told you, that deep breathing can be very effective and easy way to decrease symptoms that are associated with anxiety disorder. Muscle relaxation, especially in a place which is calm and quiet, and thought stopping can be one of the intervention for obsessive compulsive disorder, when where हम उसको ऐसा करते हैं कि जब बहुत बार बार ख्यालात आते हैं तो उसको कहते हैं कि यूं करें स्टॉप, तो इसकी वजह से जो है जो स्टिमुलस होती है विद लीड टू स्टॉपिंग ऑफ थॉट्स. इसकी मिसाल ऐसी है कि अगर हम ट्रेन में सफ़र कर रहे होते हैं और क्रिकेट की बातें हो रही हों, अचानक ब्रेक लग जाए, तो फिर जो है हम आपस में एक दूसरे से पूछते हैं भाई क्या बात कर रहे थे, दैट इज कि वो हम डाइवर्ट कर देते हैं अपने माइंड को. रिलीजियस थेरेपी, द रेगुलर प्रैक्टिस ऑफ one's own faith, according to one's own faith, will be beneficial. Then music, sports, meditation can also relieve anxiety. The pharmacological intervention for anxiety, we prefer that instead of using benzodiazepine, which are really addictive, antidepressants such as SSRI, selective serotonin reuptake inhibitor, and tricyclic antidepressant can be very good, and they are safe to use, and they have a big therapeutic range, and they are neither minor tranquilizer nor major tranquilizer, and they can having effect on the serotonin. They reduce anxiety in a very good way. Benzodiazepine can be used such as diazepam or lorazepam, oxazepam. Hydroxyzines are also used. Carbamate, nowadays they are, due to toxicity and overdose, they are less used. There are certain new drugs such as uh, azopirone in the form of buspirone. This is a drug which is non-benzodiazepine, and the other one is a tiafoxine. They can reduce anxiety. They are also not neither a minor tranquilizer nor major tranquilizer. The outcome or prognosis of anxiety, that predictors for poor outcome across diagnoses were combined depression and low socioeconomic status. If somebody is having combined depression and also they are having low socioeconomic status, the prognosis is poor. Good outcome was associated with positive treatment expectancy and high self-efficacy. So if somebody is having good expectation, or he's optimistic about the treatment, the outcome is good. The social anxiety disorder had the lowest rate of remission and are responsible for poor response. So I think the perceived social support predict treatment outcome in the social anxiety disorder. So this is the last slide, that घबराहट की बीमारी, क्या आपको अक्सर ये अलामात अंदर महसूस करते हैं, जैसे शदीद घबराहट, दिल जोर से धड़कना, बेचैनी, तो चिड़चिड़ापन, आसाबी दबाव, नींद में कमी. This can be a form of anxiety. With this, I'll end. Thank